You're listening to the MotherToBaby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
Welcome to another episode of the MotherToBaby podcast. My name is Chris Stallman, and I am a genetic counselor, a mom of four, and a teratogen information specialist. And what I do as a teratogen information specialist is I talk to people, so patients and providers, about different exposures that can happen before pregnancy, during pregnancy, while breastfeeding, or in cases of adoption. And exposures can be anything. So it could be a vaccine, it could be a medication, it could even be an illness or a condition. And today, what we're going to be talking about is the treatment of yeast infections in pregnancy and while breastfeeding. And we're very lucky to have our special guest here to talk with us today. Nevena Kristenchik is a board-certified prenatal genetic counselor and an assistant professor at the University of South Florida. She is a teratogen information specialist at MotherToBaby, Florida, and she is a mother of three, soon to be four. Nevena, thank you so much for joining us today.
Thank you, Chris, for having me on the podcast today. It's truly a pleasure to be here.
First and foremost, how are you feeling?
Oh, I am feeling very pregnant. I am out here in Florida, and we're nearing pretty much 90 degrees every day, so less than enjoyable, I would say.
Oh, I hear you. So I am not currently pregnant. However, I'm in Arizona, and it looks like it'll be 108 today.
Oh.
So yes.
Oh my God. Yeah.
The summer is upon us.
It really is. And I have the AC blasting all the time, and my husband jokes around that he's getting icicles on his beard, and I'm like, I can't help you.
Oh my goodness. Okay, so today we're going to talk about yeast infections in pregnancy. So if you don't mind, I'm just going to jump right in. How common are yeast infections in pregnancy?
That's a great question. So yeast infections are actually very common in general, but they're even more common during pregnancy. And for a lot of us who've been pregnant at least multiple times, we've probably experienced them at least once or twice. And we often blame the pregnancy hormones for this. We know the yeast infections specifically are caused by an overgrowth of a fungus called Candida in and around our vaginal area, which normally lives there and supposed to be there, but any change can kind of disrupt this, normal balance of the yeast and the bacteria that live in and around our vaginal area. So the hormones often do this in pregnancy, and it's this change in hormones that's thought to increase this chance for yeast infections.
And what happens if a yeast infection isn't properly treated during pregnancy? Because, we get calls sometimes and people say, well, I think it's a yeast infection. I'm not sure. They prescribe me something. I'm not sure if I should take it. And, of course, you're a teratogen information specialist. We always say make sure you talk with your provider, if you're not going to take the medication the way that they recommended. But what happens? What are the consequences if it's not properly treated?
Yeah, so with yeast infections, for most individuals, other than being uncomfortable and kind of itchy and sometimes painful, the yeast infections don't usually cause major problems during pregnancy to the person who's pregnant or the baby. But it is recommended to treat the infections, because if a yeast infection is not properly treated during pregnancy, we know it can potentially pass from you to the baby's mouth during labor and delivery, and baby can develop a condition called thrush. And then if the baby chest feeds, baby can return the infection back to you, causing a yeast infection on the breast or the nipple, and then for which both, the individual and the baby will need to be treated. So we generally, or generally is recommended to treat the infection because of this. Also, we do know that a yeast infection in babies can sometimes become more serious. And same goes actually during pregnancy. It's fairly rare, but we do know the yeast infections can sometimes become body-wide infections for some individuals, especially those who do have weakened immune systems, because they may have other health problems. And again, because of that, and because it is typically fairly easy to treat, it is generally recommended that they do get treated during pregnancy.
And you just wrote a blog for MotherToBaby on this very subject. Is that right?
Yes, I did.
And my guess is you discussed some of the common ways they treat yeast infections in pregnancy.
Yes, that is true.
Okay, can you give us a sneak peek? What are some of those common ways?
Generally, there's two ways that yeast infections can be treated. They can either be treated what we call topically, so this involves using an antifungal medication that's either placed inside or near the vagina, or they can be treated orally by taking a pill. For those individuals who have had yeast infections, outside of pregnancy, they may be familiar with the pill because it's typically just one dose, one medication, one single pill. But during pregnancy, it's likely that a healthcare provider will probably prescribe a topical or basically a vaginal antifungal medication. And the two that are more commonly used, we do also have fact sheets for at mothertobaby.org. They're called meconazole and clotrimazole. And people are probably more familiar with like the trade name you can pick up at a grocery store called Monistat. Mm-hmm. These are generally preferred in pregnancy because we know that anything placed topically or vaginally enters the body at a much lower amount than medications taken by mouth, and they're not usually well absorbed. So we know that they're not likely to be a concern for pregnancy over the background risk. And we always say that every pregnancy has a background risk of about 3 to 5% of having a birth defect, regardless of any exposure. The oral medication that I mentioned is something called fluconazole or diflucan. And like I mentioned, it's typically given as a single dose, like a single pill orally. When it's given in pregnancy, it is unlikely that this one single dose would cause any pregnancy complications. However, because higher doses of this medication in the first couple of weeks or in the first trimester of pregnancy have been associated with maybe an increased risk for some birth defects or miscarriage, the Center for Disease and Control and Prevention, so the CDC, does recommend that providers preferentially treat via the topical or the vaginal medication as opposed to giving the oral medication. So that may be the reason why the healthcare provider goes with the vaginal medication this time around.
It's good to know that there are options, though, that they can sort of assess the situation and say, okay, this is what we're going to go with. And good to know that treatment options are available in pregnancy. Because as you said, typically, the person who's pregnant, the preference is going to be to treat them for a condition like this.
Exactly. And I do want to add that, if somebody's already because there are some stubborn yeast infections and sometimes topical antifungals are not going to work, or if somebody's already taken the oral antifungal medication during pregnancy, or they maybe did not know they were pregnant or something like that. Again, typically this one single dose is not expected to increase risk for the baby.
So can these two medications in particular, can they also be used in breastfeeding, or are there other preferred ways to treat when someone's breastfeeding?
Great question again. So they're actually treated very similarly during breastfeeding and during pregnancy. So just like in pregnancy, because only small amounts of the antifungal medications are expected to pass into the systems, the pregnant person's or breastfeeding person's system, and then into the breast milk, both the antifungal creams and the antifungal pill, when used as prescribed by the doctor, are really unlikely to pose a risk to the breastfeeding baby. The other thing that I did mention before is that in case a yeast infection develops on the breast and the nipple, both mom and the baby generally do need to be treated. So the healthcare provider will talk a little bit about kind of the differences between those, because treating the breastfeeding individual only usually does not pass enough medication to the baby to treat the baby as well.
That's really good to know. I too think about sometimes some of the questions I get, and when I've been pregnant and breastfeeding, some of the questions that I had personally, like there were a couple of times, especially in my most recent pregnancy and delivery, where I had wondered, am I getting a yeast infection? Kind of what's going on with that. And what I tell people, what I tell people who contact MotherToBaby and ask something similar, say, I think I have a yeast infection, I have this at home, or I've used this before, can I use this? What we always stress is that you have got to have a discussion with your healthcare provider, especially, if it is a yeast infection, you want to make sure that you're being treated the way that they would suggest. Or if it's not a yeast infection, making sure whatever it is you do have is treated in the proper way.
Yeah, I very much agree with that. So, the some of the signs and symptoms of a yeast infection, like the itching and the burning and the redness or discharge, can mimic some other common infections and even sexually transmitted diseases in pregnancy. So sometimes, we're kind of tempted to self-treat over the counter, especially if we've had infections before. But the reality is that because there's other conditions that can mimic this, we do strongly encourage visiting the doctor and making sure that that you are treating yourself or they're treating you for the right thing. And same goes if you've been using something over the counter like a monostat and it's not helping relieve the symptoms. Make sure to do contact the healthcare provider.
Such a great reminder that if your symptoms don't get better or if new symptoms come up, yeah, absolutely check in with your healthcare provider. Well, Nevena, we're at the end of this podcast, but is there a final thought you would like to leave our audience with?
So I was going to add, we unfortunately cannot do much to change our hormones during pregnancy, and some of us may not be able to change, the humid conditions that we live in, but we do know that thankfully there are treatments in pregnancy for a yeast infection, and none of us need to suffer through it while we're pregnant. But since we are coming up on the summertime and there is going to be a lot of wetness and humidity, and yeast love to thrive in wet and humid conditions, some of the advice that I come across a lot, or even our obstetric providers give our patients a lot, is just to change out of wet and sweaty clothes, including bathing suits and even like jogging and leggings as soon as you can. And then we always remind everybody that ideally they should maybe sleep in some looser fitting pajamas or not too tight of underwear, and then just use plain clean water to clean outside of the vaginal area. So avoid any products that are scented that come in contact with that area. And again, while we cannot prevent some of these infections from happening, at least hopefully we can minimize some of them in pregnancy.
Agreed. Nevena, thank you so much for being with us today. And on behalf of the show, I would like to wish you the smoothest delivery and postpartum period possible.
Thank you very much. That means a lot.
And thank you to all of you. That is going to be the end of this episode. As always, we're very happy that you were able to join us. Don't forget that you can subscribe to us so you never miss a new episode. So you can find us on iTunes, Spotify, or wherever you get your podcasts. You can also go back and listen to previous episodes of the podcast. And of course, MotherToBaby is interested to hear from you. So if you have an idea for the podcast, if you want to be on the podcast, we would love to hear from you. So feel free to email us at contactus@mothertobaby.org. You can also contact MotherToBaby directly if you have any questions about exposures. So you can reach us by phone at 866-626-6847. You can text us at 855-999-3525. You can visit us online at mothertobaby.org. On our website, you can chat live with a teratogen information specialist. You can also check out all of our baby blogs, including Nevena's blog on yeast infections. You can also find the MotherToBaby podcast episodes there, and you can find our fact sheets. So we have over 250 fact sheets. As Nevena mentioned, some of them are on the medications used for yeast infections, but a whole range of topics. So feel free to visit. So that's all for us today. Thank you for joining us. And remember, Mother2Baby is here for you. Take care.
Mother2Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother2Baby, please visit mother2baby.org.